Okay, I want to give you an example of where a doctor called me. And I want to talk about the liver and the section in the manual where we say no alcohol and no Tylenol. Why? Most of our patients have fatty liver. Most of our patients have fatty liver. And the surgery makes that better, but it also stresses the liver. And we can see that forever after the surgery in slightly elevated liver tests in the blood. So if you go to your doctor and ask him to test you a year from now or 2 years from now, almost everybody has mildly elevated liver tests. If that happens, sometimes doctors will get tense. They'll say, oh my goodness. They'll say, you have hepatitis or something awful, okay? And then they'll start doing all kinds of tests and everything. But sometimes the patient or the doctor will call me. And if they do, I talked to a gastroenterologist in Boston the other day. He said, I've got a patient here of yours, and she has elevated liver function tests. And I said, they all do. And I gave him the talk that the surgery causes the fatty liver to get better. It does leave a slightly elevated liver function test forever. We wouldn't recommend doing anything about it. But we have had good local doctors who have gotten wound up and done, thousands, tens of thousands of dollars of testing, and it's always been basically fine. So I said to you, if you want to do a big bunch of tests, that's okay. Send me the results if you find anything or not, so I can tell my other patients. But in 12 years and 5,000 people, basically, your liver's fine. But it is stressed, so don't add any other liver damaging drugs into the system. So alcohol and Tylenol are off limits because of that. But that's an example where a doctor called me, and we talked, and he was real happy